Hi everyone, let us wait for few more seconds. Thanks for you all joining here. Please let me know if I'm audible or not, okay? Sure. Just type on the comment section if I'm audible. Hi everyone, let us wait for few more seconds. Thanks for you all joining here. Please let me know if I'm audible or not, okay? Sure. Yeah, I have fixed the echo. Thank you, Sindhu. Is it audible now, or is it still echoing?
Still there is an echo.
It's audible.
Thank you. So, hello, Melvin sir.
Yeah, hello.
Good evening.
Hello, good evening. There is some echo still in the background. Yeah, now it's stopped.
Nice background, sir. Very cozy for the, like 9 o'clock talk.
I hope people don't sleep off because of that.
Looks very realistic. Nice. So,
Is Supro joined?
hopefully.
Yeah.
Let me see. Yes, he hasn't joined.
Okay.
There was some issue in some registration issues over there.
Okay. Yeah, now it's fine. The echo part is stopped.
The background YouTube was running. I forgot to switch it off.
Okay. Um, the speaker, Dr. Subro, is having some issues with connecting to the Zoom meeting. So we're just trying to sort out that issue right now. Just kindly bear with us for a few minutes.
Hello. 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 We are unable to hear.
Madam, we have not started. The session is about to begin now. Dr. Subro is just trying to connect. There's some connectivity issue. So we'll be starting shortly.
Hello everyone. Sorry, finally got in after a lot of problems, but finally could make it. Natesh, I'm in. Yeah.
Yeah. Hello, Subro.
Yeah. Hi.
Hello, Dr. Subro. Dr. Subro.
Hi. Hi everyone. Hi.
Thank you
Too
so much for
much.
joining.
Too much of security. I must say. Too much of data security. Yes. Go ahead, please.
So thank you everyone. Thank you for your kind patience. Apologies from my side. So this is the first time this is happening for all like this, and we never expect this to happen. And let me close everything over here. Let me keep it very clean. So once again, welcome you all to this exciting meeting because once Dr. Shipro he posted his recent research on Facebook, the research comparing Covaxin and Covishield. I thought we should do one program for everyone. And he and Dr. Melvin, so generous among the busy schedule, to spare the time for us to educate us. Because I chose Dr. Melvin because he has been working on vaccine traits for a long time, and he has corrected phase 3 trial for Covaxin. So let me give a formal introduction to Dr. Subramoorthy. Many of us know about him very much, but it's my like responsibility to introduce the club because there are multiple non-pharmacologists over there. And let me take the privilege to introduce him. So he is currently the clinical director for academics and the research department and at the PS Hospital and BK Royal Research Center in Kolkata. He is the first in India who has done the fellowship of ISQA, and he is the ISQA medication and safety expert, and he is also the NAB assessor. He has multiple oral along his name, and because of the constraint of the time, I'm going to skip that. And both are my very close friends. And next is Dr. Melvin George. Again, he doesn't need any introduction. He has finished his MD and DM both from JIPMA, and he is being researcher at SR Medical College and Hospital, and he is the associate professor in the Department of Clinical Pharmacology in SR Hospital in Chennai. He is also the ethics committee in charge in Hindu Mission Hospital in Chennai, and head of the ethics committee. Very keen researchers and who believe in research and the content. And I'm not going to waste much more time. Dr. Subrajyoti, Dr. Melvin, please take from here. Thank you.
Yeah. Thank you, Natesh, for the kind words of introduction. So, thank you all for very patiently waiting for us to connect and start this meeting. So, the context of what we are going to discuss for the next 30 or 40 minutes is basically we're going to see a study that was done in the midst of the pandemic. Of course, the data was done, collection was done in a retrospective fashion, but it is essentially something that was happening right in the midst of the pandemic during the second wave between April, May, on the how effective were these vaccines in preventing outcomes COVID-19. That is something that the study is trying to address. And I'm sure all of you have read several papers related to COVID-19 trials. We all know that trials are always a very ideal world. It's a very hypothetical scenario. And many times what we see in trials is not what we see in the real world. So it's so important that real world studies are done to see practically when the rubber hits the road, what really happens with vaccines. Is it really that effective as what is claimed? That is what we all want to know. And the investigators in Calcutta, led by Dr. Subro, who is a very well-known figure to all of us, have done this remarkable study, and Dr. Subro is going to present this study with us to us now. So I hand over this time to my friend Dr. Subrajyoti Bhaumik. Over to you, Subro.
Thank you, everyone. Thank you, Melvin, and good evening. Thank you at the outset to Dr. Nadesh for organizing this. And it's a privilege to be here amongst all of you. And I also thank you for your immense patience because if I had been one of the in the participants, I would have dropped out by this time. So thank you very much. I have a very small presentation, and I think we have more of the discussion. And with Melvin being here as one of the moderators, my life is easy because I've already got a list of uh, questions as well as queries from the peer reviewers who have reviewed our articles. I'm just give me a Natesh, it says host, disabled participant screen sharing. I would request you to enable my screen sharing if that is possible. Natesh, are you able to hear me? Yes, now I'm able to share. Thank you very much. Please let me know if you are able to see my slides.
Yes, yes, bro.
Okay. So this is our very small effort in the real time scenario, as they say, to look at the incidence and in-hospital mortality of COVID-19 patients post-vaccination in our part of the country in Eastern India. So I come from Peerless Hospital, and in that hospital, I am the clinical director for research. So let me begin with the disclaimer that the data discussed in this paper, I'm sorry, the data discussed in this paper here is in the peer review stage of a journal. For confidentiality purpose, I'm not able to review the journal's name. And you might find when the paper comes out in publication that it might be modified. Some information may be modified depending on the peer review. And I'm very happy to tell you that we have already received a positive peer review report from one of the journals, which was very interested, and it has given us some very constructive peer review points, and as we are changing the article accordingly. So, as Dr. Melvin said, that effectiveness of Covishield and Covaxin in the real world scenario against moderate and severe COVID-19 has not been measured much. We have great studies coming from CMC Vellore. There is a study which is published yesterday, again a preprint server publication from Apollo. There are a few studies from North India as well, but they are basically with respect to the immunogenicity. And in fact, in my city of Kolkata, we had a very, a study done by one of the endocrinologists on the immunogenicity of Covishield versus Covaxin in healthcare workers. So majorly healthcare workers have been looked upon. So because in Eastern India, the comparable effectiveness of Covishield and Covaxins vaccines have not been studied, we embarked on this journey. So we know that the efficacy and of AstraZeneca's Oxford vaccine, which is Covishield, is roughly around 70.4%, and this is after the second dose is given, and at 6 weeks. And this is the data from the Lancet. And on the other hand, Bharat Biotech vaccine, Covaxin, is results in seroconversion rates of roughly around 85 to 87%. And this has been reported again in the Lancet publication, which this company has done. So uh, this both have elicited immune response. As Melvin was mentioning, that both have elicited immune response. But when the real scenario, what is the scenario of these vaccines, and how much protections have they given? And especially while I speak, let me tell you that the Kolkata study of Dr. Singh, if you research, and it was again from the MedRx preprint server, it went viral in India, where the information was given that Covishield was better immunogenicity. It had better immunogenicity in Covax than Covaxin. And we at the hospital level, we have been wronged with these questions. And in fact, people were saying that Covaxin was not protective in nature. So we did a retrospective observational study, of course, after the ethics committee approval was given, and data of the patients who were admitted with moderate to severe COVID-19 from 15 March to 31st May 2021 at PLS Hospital, Vikiroy Research Center in Kolkata were collected from medical records. And our center is a 400 bedded hospital, and we have a 30 bedded ICU dedicated to COVID-19. And April and May, and of course, end of March, we had mayhem like any other hospital in the country. and there were hardly any beds which were available. So we definitely saw the brunt of the second wave, as many other participants would agree with me. And we called up, we looked at the details of the vaccination status, and we all the comorbidities were documented. And we also our one participant, one researcher from our team also spoke to these people when the study was being conducted, retrospective analysis, which was in the month of June, that whether they are still surviving or not. So this we have made a phone call to every individual to verify who was surviving. So the proportion of patients contracting severe COVID-19 post-vaccination and in hospital mortality rate was analyzed, and effectiveness was compared with respect to incidence and in hospital mortality. Statistical analysis was performed, and we got the help from a wonderful statistician in our team on SPSS 27 version and GraphPath Prism version 5. Descriptive statistics were used for demographic variables. Chi-square test was used for categorical variables, and we performed a univariate analysis to determine the risk factors of in-hospital mortality post-vaccination. And this was suggested by our statistician that the univariate analysis has to be performed to determine the important risk factors for in-hospital mortality. And p-value of less than 0.05 was considered significant. So during this time period, 294 patients were analyzed. They were admitted with moderate to severe, of which 5% of the people had taken Covaxin, 26% had taken Covishield. And this is in sync with the current vaccination schedule, which is going on in the country, where 90% of the vaccination, in fact, more than that, 93% of the vaccination in India is currently done by Covishield and 7% by with Covaxin till June. Now, some at least 1.75 lakh people has been administered the Sputnik vaccine. And now look at this, like 68.4% of the people were unvaccinated. So this was one of our findings, which we are saying that there is always a question that, you know, whether the vaccines, they are protecting, not protecting. And definitely 201 patients were unvaccinated out of this 294 patients, and this clear cut, without even statistical tool, we can comment that this is statistically significant. Of those who were vaccinated and contracted COVID-19, 24.8%, they had taken the first dose, and 6.8% had taken the second dose. Now, the 17.3%, they were this is very interesting, and I have put this data purposefully, that they were unable to recollect the date because we were calling them up. They were unable to recollect the date of the vaccine and the dose of the vaccine when they were taken. But this we found out from the medical records. So sometimes the reason I highlighted this is that even if we are doing any study where we are recollecting the information just by recollection of the knowledge of the patient population in COVID-19, it might not be always handy. So of the various comorbidities, the diabetes was top on the list. So 101 patients had diabetes, 115 patients had hypertension. We had patients who had chronic kidney disease. We had cardiovascular disease patients, lung diseases like COPD, emphysema. They were admitted, and there were 4 malignancy patients who were admitted. So the in-hospital mortality was around 40 patients had died out of this 294, of which, interestingly, 3 had taken double dosage. And this double dosage was taken by both the double dosage were of Covishield, and 11 out of 40 had taken single dose of Covishield, and 2 out of 40 had taken single dose of Covaxin. So when the univariate analysis was performed by the statistician, there was no significant association which was found by the type of vaccine in the in-hospital mortality, but significant association was found with the presence of diabetes and presence of cardiovascular disease and malignancy. And the odds ratio, if you see, is 2.13 in case of diabetes mellitus. Cardiovascular disease 2.1 odds ratio, and malignancy is 2.3. Interestingly, many of the people, they ask us that we have hypertension, we have diabetes, can we take the vaccine? I think this small data, which we are getting at our hospital, and this is minded, ladies and gentlemen, these are from the severe, moderate to severe COVID-19 patient, clearly tells us that if you have diabetic patients at your home, if you have patients who have cardiovascular diseases, if you have malignant patients, I'm sorry, patients suffering from malignancy at your home, definitely these are the patients who require vaccination, irrespective of what vaccine they take. So no association was found with in hospital mortality with hypertension. This is very, very interesting because there is data coming from western part of the country that hypertension is one of the important killers in COVID-19, but this we did not find in our data set. Chronic kidney disease and in case of lung diseases. So this is another important interesting part. Now, we also calculated the interval between which the doses was taken. So majority of the people who had suffered the infection below 14 days of getting the second dose, their odds ratio of getting a of dying was much more. And diabetes mellitus I've already mentioned. So the difference of dosage, the interval between COVID-19 disease and the vaccination has come to be significant as well. So when we discuss this study, I would say that the interval between the day of COVID-19 positivity and vaccination has found an association with in-hospital mortality. We are doing further analysis. This is one peer review comment which has come that they want a separate chart on this because we had just done below and above 14 days. Now they want a breakup of every day, and they have asked us to give us the breakup of below 14 and above 14 days. So we are doing that. And diabetes mellitus, we particularly find that, though Covaxin has been given to only 15 cases, but the mortality rate in Covaxin has not been statistically significantly different from the mortality rate in case of Covishield in this data set. So diabetes mellitus, cardiovascular diseases, and malignancy in our data set have significant association within hospital mortality. And there are few studies which we have cited. The study which Foy et al. Concluding, and this is coming from the United Kingdom, saying that it is very, very important that the older age group must be prioritized to vaccination to reduce mortality rate. This is going in sync with our data set because the majority of the people here who were elderly, they had cardiovascular disease and diabetes mellitus. And there's a study which says that which of Ikabuchi, which suggested that single dose was only 33% effective against this Delta virus variant, which is first detected, and Covishield. Now this finds to be 60% effective. We have not done any genomic analysis. That is one of our weakness of the study, that we have not been able to do genomic analysis of the 93 people who have been infected because of the lack of infrastructure. And we have studies which are saying that the majority of the second wave was caused by the genomic by the Delta variant, and this causes the lack, which causes the mutation in the spike protein, and this is so the effectiveness studies like this is very, very important to understand how this mutation, the Delta variant mutation, is working in our setup. We also found that, people who had received the second dose of vaccine, they were only, please remember that this is in the month of April and May, where India had just started the vaccination for the comorbidly ill 45 years and above people. So definitely the 6.8% were infected after second dose. The interval post vaccination has been found to be important. So with more is the time, the lesser is the infection rate. And this is, of course, in sync with the paper which is which is being published in PGI Chandigarh by Pal et al., where diabetes mellitus has been found to be associated with poor prognosis if they have been infected with COVID-19. This paper also suggests that patients with diabetes mellitus, cardiovascular diseases, and malignancies should be prioritized. It's one of the early papers published in March 2021 from PGI Chandigarh. So we have definitely our studies limited, that we have retrospective study design. So as I showed you that there's a recall bias, but we have tried to check with the help of medical records. And of course, 294, many people may argue 294, of which 40 people are dying. It's a very, very small sample size. But our main intention was to show that out of this 294, 201 patient did not take any vaccination, and which has resulted in case of severe vaccination, severe disease, moderate to severe disease. And among the 40 people who have died, 26 people had not taken any vaccine. So the message is very clear cut. And with respect to Covishield and Covaxin, the statistically significant improvement with Covishield is not being witnessed, though Covishield is being given in a much more number. Statistically significant difference has not been found with Covishield, and probably I think the limitation of the sample size could be one of the reasons. Nonetheless, I would say this is the first study which we have. I'm yet to find anything on the preprint server from Eastern India regarding the effectiveness of these two vaccines in our country. And this is extremely important because a lot of myth is going around against Covaxin, that Covaxin has not gone any clinical trials in the country. Covaxin does not protect. Covaxin produces less immunogenicity. So many of the doctors have this mindset that Covishield might work better and might save more lives. So so to conclude our study, I would say that the interval between vaccination and the day of COVID-19 has significant devastation in mortality, and I think COVID appropriate behavior has to be continued even if you take the vaccine. In this particular data set, we did not find the Covishield to be better than Covaxin, because that was, honestly, if you ask us, that was the hypothesis, because the number of patients receiving Covishield was much, much more. And we were expecting that Covishield might protect more lives, but that has not happened. And diabetes mellitus, cardiovascular disease, and malignancies had significant devastation with in-hospital mortality. And of course, we again reiterate that large-scale multicentric studies will be required to verify our findings. My only thing, what I would say is, when this paper came out in Medrix, so at least in the Kolkata version, they had covered, Times of India had covered this particular thing, that this was a positive story. I would say that only 3 out of 40 victims die after taking 2 shots. And the positive signal which we wanted to give the society is that take vaccines and save lives, because vaccines are the only way to save your life. So these are our references, and this is our small initiative. Now we are still dredging, I would say, the data. I'm sorry, we are still dredging the data. We are trying to look at the more data analysis, and this is the initial data which we have found out. So over to Melvin for the discussion. And again, I would say that we are still we are doing a lot of changes in the analysis, because our peer review has just come yesterday, and our intention was to really show that in case of severe and in case of moderate to severe COVID-19, more people die who don't take vaccines. And there are very important comorbidities, because comorbidities play a very big spoil sport even if you have taken the vaccine. So better not wait for the comorbidities to kill you, rather than try and save yourself by taking the vaccine.
Okay. Thank you, Subro, for your presentation. Firstly, I would like to congratulate you and your team for embarking on this journey to do this particular study. Although it's a retrospective study, it is very pertinent, because it talks about the situation on the effectiveness of the vaccine at a time when the prevalence of the disease, when the incidence of the disease is very high. The same study, if you want to replicate it now, it's not that easy because of the simple reason that now the disease has waned so much in most parts of the country. Having said that, now let's talk a little bit more detailed about what the study has thrown light. And there is a saying that sometimes, even though certain things are obvious, unless you do a study and prove it, it is not really the case. As the saying goes, no, the proof of the pudding is in actually eating it. So that's what Subra has shown. What everyone has been saying, uh, theoretically talking by hearsay, that vaccine works and all that. Finally, we are seeing that in action when COVID is at its peak. So I think the main part of the main message of this paper is definitely that number one, as a whole, if you look at vaccines certainly work because only 7% of people who took vaccines manifested with moderate and severe COVID-19. So that's I think the main message of this paper. Even that is not clear for so many people who are still grappling, even today are not convinced with the efficacy of the vaccine. So this paper definitely highlights that. That's great. And apart from that, there are definitely certain questions that I would like to ask you. And of course, so many questions are coming up in
I see a
chat
lot of
box.
questions coming up.
Yeah. So I'm not sure how much we'll be able to give justice to each and every question, but we will try our best.
Yeah.
So to start with, let me ask a single question. So you spoke about moderate and severe COVID-19 as a whole, and then you also spoke about deaths. Do you have any particular data on how many of the patients specifically who took COVID-19 vaccines needed ICU admissions and needed ventilator care? Any specific data on that?
Yeah, so this was not a part of the study, but we are continuing this study. Let me tell you, because this study was basically an initiative to show that vaccines protect in ICU. But now, as we are one of the vaccination centers in the city, so I will tell you the data we have till the data of March 31st. So we had, but till March 31st, we had vaccinated roughly around 6,000 people. And in 6,000 people, this is roughly 5,8 something is the figure. I am not very sure. So it is around, I will round it to 6,000. So out of 6,000, these are the people who were admitted in the ICU. So if I take it round figure as 300 out of 6,000 is what were who came to us. And let me tell you that these 6,000 people were not vaccinated at single point of time. So somebody might have, the majority of them, India was also undergoing a lot of transition. If you understand that initially when we started with 4 to 6 weeks. Then mid of April, it was changed to 8 to 12 weeks. So the Covishield vaccination program has changed a lot, and that has probably has given, it has reflected on the effectiveness of the vaccine also, if I could say. So this is in this paper, this is also very clear that majority of the people who are receiving one dose of vaccine, they are not protected. This paper is also showing another thing, that we must try and complete our vaccination as soon as possible. So if there are somebody is receiving one vaccine, they are not being protected. So yeah, so we have around 6,000. This is the 300 Melvin is for severe. And when we have asked that how many people had actually got mild to moderate, we have close to around 750 people who have got mild to moderate infection. So roughly around 1,050 people had infection post vaccination, of which 300 went to the ICU. So that is also, you can say, one of the, we can say about the effectiveness of the vaccine, that yes, even if the infection is happening, it's remaining mild to moderate. And out of this 300, only 40 are dying. So this is majority, I would say, is showcasing the protective action. Again, I would tell you that we are continuing this study and we plan to collate the data for 6 months where we will have concrete information of two dosage of both the vaccine, because now Covishield second dose is being given at 84 days. So we want to have adequate sample size, 100 each or 200 each on both arms, and try to look at the effectiveness. So that is the statistics.
Yes, certainly. So I think even another message that we can take from this paper is just taking one dose and remaining silent will not really solve the problem. We definitely see that there is almost, I think, 24%, right? 24% had moderate or severe COVID-19
Absolutely.
in spite of one
Absolutely.
dose of vaccine. So that's a very, very strong message for taking the full dose vaccination schedule, and rather than just taking a single dose. Okay, now there is one interesting question that was asked by one of the participants, Abhishek. What was the duration between getting second dose and severe COVID-19 and the 3 patients who died despite getting the second dose of Covishield?
Yeah, so let me
Was
first
it
describe
adequate
the
or?
yeah. So let me describe the three patients. So these three patients were severely morbid. They were all above 65 years of age. These three patients, three of them have diabetes mellitus. One had undergone a renal replacement therapy for which he was receiving the immunosuppressant drugs. And the one because he had gone the renal replacement therapy because of the malignancy, so he had undergone that. And the other two had cardiovascular diseases. So they had multiple comorbidities. What comorbidities we showed? All three had diabetes mellitus, two had cardiovascular disease, and one had a renal cancer. I'm sorry, one had a renal cancer. So and he was on chemotherapy for renal cancer. So they had received, the three of them had received double dosage, but very unfortunately, they had contracted the disease within 14 days of the getting the second dose. So this is also becoming clearer that more is the dosage, the difference of dosage. We are talking that the body requires some time. So these very, very sick morbid patients, they could not be saved because the antibody level could not be of that level that the COVID-19 severe infection could have been stopped. So this is the characteristic, because even if we look at the other patients who have died, the other 11 patients who have died, I would say the common feature in them is that all of them have received the vaccine. The second majority of them had the first dose vaccine, so they did not have the second dose vaccine. These three people who had taken the second dose vaccine, they were below 14 days. So we had done the analysis. Now they want the journal wants us to give us specific days and individually calculate the odds ratio. So we are doing that.
Yeah, so even the 3 patients who died, the summary is that they had strong reasons for comorbidities for having an increased risk of mortality. So that could not be something that prevented, and even the dose duration was not sufficient. That's what I understand Subra said. So any other questions from the, there are a lot of questions which are general questions which are not directly related to this presentation. But maybe
I want to answer one of the doctor's
yeah.
question is, what is the preferred vaccine in pregnancy? Doctor, thank you for asking that question. I would say, as spoken, whatever we have spoken to the gynecologist, it is better to give a killed vaccine like Covaxin in pregnancy, and they prefer it because it is being recommended by the gynecological societies in India as well as in America. So definitely there is no data in pregnancy regarding vaccine, but there is data of COVID-19 infection in pregnancy, and we now really know that the transplacental in the communication of transplacental passage of the infection happens in case of 1% of cases. So definitely we need to give the vaccine in pregnancy, and the idea is if we can give Covaxin, it is good, but Indian government guidelines are very, very clear that you can give Covishield too, as well as Sputnik. This is an interesting question and important question I wanted to, because Still now, many gynecologists are wondering whether to give the vaccine or not to give the vaccine. For the larger audience who are sitting here, let me tell you that during the second wave, 7 times more pregnant ladies were killed or they died, unfortunately, than the first wave. So it is clear cut from the ICMR data that the pregnancy is a big comorbidity in a woman, and because as we are vaccinating other comorbid patients, we have to vaccinate our pregnant ladies also, and we should not waste any time and vaccinate.
Yeah, what about patients who are autoimmune diseases or those who are on steroids? Can they receive vaccinations? This is another
Yes.
question.
Yes. So autoimmune diseases, answer is yes. They will receive the vaccine because of and for steroids, if it is a dosage of steroid, which is important, if it is more than 60 milligram prednisolone per day, it is better to taper it down to 30 milligram and give the vaccine. And then eventually after 4 weeks, if you're getting Covishield, so you taper it down to 30 milligram and you give the vaccine, keep it till 30 milligram for 4 weeks and then increase it. So that is what has been recommended. But definitely anybody who's receiving steroid is an immunocompromised host, and COVID-19 can cause havoc in these people. So we must vaccinate them. This is not a contraindication. Any autoimmune disease or any person who is receiving high dose steroids, please remember they are not contraindication for the COVID-19 vaccine.
And similar question in line to that, what about cancer chemotherapy? Patients who are receiving cancer chemotherapy?
Absolutely, Melvin. And we have as you said, the proof of the pudding is in eating. We have the data here that, we had 4 malignancy patients and they all suffered from severe infection. And unfortunately, we lost one of them. So please remember that malignancy, we have to give them vaccine. And again, I want to reiterate this, malignancy is not a contraindication for vaccination. Contraindication for vaccination is only two conditions. They're very clear. One is any history of anaphylaxis with a previous vaccine, or if you have any sensitivity data or any allergic reaction to any of the component of the vaccine. Either of the two is tick mark, then you can't give the patient vaccine. But if anything else exists in the patient, please, we have to go ahead and give the vaccine. And Melvin, to be very honest with you, our comorbidity data has been really inquired by lot and lot of patients. We are coming out for frequently asked question also in our hospital, that depending on our data, we are recommending and requesting all our patients who are coming to the medicine clinic, all our patients who are coming to the oncology clinic, that they should take the vaccine, because this is a clear odds ratio is very high in mortality with respect to mortality.
Yeah, in spite of several reminders from the government and several sources, there is this thing that vaccination should be taken only by people who are healthy. People who have comorbidities should avoid it because it is too strong for them. They'll not be able to tolerate it. So all kinds of myths are permeating in social media. So again, this study adds the point that comorbidities are just going to increase mortality due to COVID. But in terms of people who get vaccination, definitely those with comorbidities should be all the more receiving vaccination. So another question related to this same issue is about can vaccination help in conferring immunity to the people who are not vaccinated, particularly children? Suppose the adults in the home are all vaccinated, can it prevent transmission of COVID-19 to the children?
That's a very good question, and I think it is a question for research. And whatever information is available from the Indian Academy of Indian Academy of Pediatrics, and I will quote from there, is that one of the policies which the Indian Academy of Pediatrics has recommended to prevent infection in India among the children is to vaccinate the caregivers and the immediate family members, because in India we don't have vaccination for children yet. So definitely it will break the chain, because children are with the adult people, and luckily I would say, even if the children are getting affected, they are getting affected in the first wave and second wave. They did get affected by God's grace, and they are not severely infected. So vaccinating the caregivers and the immediate family members is an effective strategy.
Yes. Some more questions. What about suppose if a patient is getting infected with COVID-19, we talk about giving them vaccination after 3 months. That's what the government says. So this time period of 3 months, is it from the day of infection or from the day of recovery?
That's a very good question, and let me tell you my practical experience on this. The government says it is from the day of recovery because you are expected to generate antibodies 10 to 14 days after you have recovered from the infection. So it is from the day of recovery. That is very clear. Number two is, do we really need to wait for 3 months? I would say that if people who have got the milder form of the disease, like they just had fever for one day and they tested COVID positive, or they had an anosmia we know is very, very milder form of the disease. Frankly speaking, my personal experience has been that they have not been able to generate a lot of antibody. Because if we look at the antibody testing, which is happening at 2 months, and I'm recommending it to at least the patients who have asked me personally. So I have seen, and I have data now where we have seen that many of them have come out with low antibody levels. So my recommendation will be that 8 weeks, please get your antibody levels checked. If you have high antibodies, wait for 4 more weeks because the next dose will be acting as a booster. If you have low antibodies, please go ahead and immediately vaccinate yourself. Because interestingly, the government center or the private center where you are going for vaccinating, even the COVID app is not asking for your COVID-19 positive or negative report. So the government has made a policy, but the loop is open. So had they closed the loop by linking it, the COVID app with our Arogya Setu app, where we were uploading the COVID positive report, then this would have been made easy. So I think the loop has not been closed. So on my practical experience, and this is what I've recommended to my brother also who suffered from COVID-19, and he interestingly found out that after 2 months, his antibody levels were not high because he suffered from the milder disease. And he has gone ahead and taken the vaccine because the government does not stop you from taking the vaccine at 2 months, but definitely scientific data is required. And the only scientific methodology is to have antibody testing.
Yeah. Another question. So before that, Natish, may I know when we have to
We can
close?
stop, yes, because we started
Because
late.
we started late. So
Oh, I think like I leave the speaker and the moderator. I think we can
Have
go.
another 5 minutes.
another 5 minutes, yes.
Yeah, we'll take last 5 minutes. So
Yeah.
just I'll take a few more questions. And then
Forward a few questions to you as well,
yeah.
whichever is the
So,
best.
yes.
Questions,
So,
chat box, not relevant.
so there is another question about again. I think there is a lot of background noise, Nitish, here. So there is another question. Suppose a person has taken 2 doses of Covaxin, and now he wants to take Covishield. What is the time? How much time he has to wait before he takes the Covishield? Probably he needs it because he's considering to travel outside because of the travel restrictions for vaccines for Covaxin. So, how much time gap would you suggest if you
The
are?
clear cut answer, Melvin, here is that he cannot take it in India because the government is very clear. We don't have vaccines for 130 crore people. We cannot afford the luxury of vaccinating one single individual with 3 vaccines. So we can't take it in India. If the person has to go abroad, and this is exactly which has happened, is that if Covaxin is not approved in, say, for example, XYZ country, you carry the COVID negative report, RT-PCR report, and then you have to follow the guidelines of that country. Where in certain countries they are asking you to be in isolation for 7 days or 10 days, after which an RT-PCR is again performed, and if you are found negative, they allow you, they let you move into that country. And if you are planning for a long-term stay, then probably if they are not accepting Covaxin, which I expect to be approved by WHO by next month, there is a high possibility that WHO will approve this. Then we have to accept the fact that if we are living in that country for a long time, we have to go and get ourselves vaccinated with the other vaccine. And like any other traditional knowledge which we know, the dose difference between 2 doses of vaccine, the time difference should be at least 4 weeks. So at least 4 weeks, 2 vaccines should be separated. So if you've taken Covishield and left India, then you must wait for 4 weeks to take your, Pfizer or Moderna or whatever vaccine you get abroad.
Yeah. Another thing is about the role of ICMR in this vaccine approvals. So does ICMR have any role in vaccine approvals? Some people want to know about that.
Well, I don't think so. They've got a direct role. It's a DCGI's is the main body, the Drug Controller General of India. ICMR has played a wonderful role in development of the Bharat Biotech vaccine because it is the knowledge partner in the study design and the clinical trial. I think Melvin can say much better than me. He has been the principal investigator of that particular trial. But ICMR is not the regulator, in approving the vaccine.
Yeah. ICMR has been very actively involved. The National Institute of Virology, Pune, has been very actively involved in developing the vaccine at the initial stages for Covaxin. But of course, when it comes to approvals, vaccine is considered equivalent to a drug approval. So it is the CDSCO office which usually reviews vaccine approvals. So as of now, both Covaxin and Covishield have got emergency use authorization. They have still not got the full approval as like any other vaccine abroad. So there is one final question. Is there any risk complication noted in post-COVID patients after taking vaccination?
Yeah,
We'll
so
take this question and then we'll close.
Yeah, so to Dr. Susan, yes, answer is yes. Anything which has got an effect will have a side effect. So I will say risk and complication. I must admit that our AFI capturing has been weak in the COVID portal. We are just doing active surveillance for 30 minutes, after which when the patient goes home, frankly speaking, they are going to their general practitioner, they are coming back to their physicians with complications, but that is not being captured in the efficient way and sent back to VVPI in the country. So that is one definitely a weak, the weak weakness in the system. But having said that, the risk or complication post COVID-19 vaccination, whatever the data is coming from ICMR, and whatever we tend to look at the data, the incidences of thrombosis, there was a question that, Covishield is resulting in thrombosis. So in Indian population, the incidence of thrombosis has been found to be significantly low than what has been found in the UK population, and it is not statistically significant at all. In Covaxin also, the incidences of anaphylaxis or any other incidents which can result in death of the patient has been very, very low. There are few deaths which have been now associated with AFI, but it is not so alarmingly high, which can result in stoppage of the vaccination program in the country. Your final thoughts, Melvin?
Yes. Yeah, so two things I would like to say. One is that a lot of you have been asking, even in the WhatsApp, about the booster dose and when is it really needed. So currently there is an ongoing study that is being done by Bharat Biotech on whether we really need a booster dose and what is the efficacy of this booster dose in preventing COVID-19. So we still don't have data to really say the value of a booster dose for COVID-19 vaccination. And since our country is still grappling with giving 2 doses of vaccine to the bulk of our population, this is not really something of urgency that is even taken by as a recommendation by the government of India. So in closing, I would again say and reiterate that this study that we have just heard, which Dr. Jyoti was presenting, is really highlighting the important issue of how COVID-19 vaccines can prevent moderate and severe COVID-19 infections, can prevent death. Probably, I mean, this is also a comment by one of the members. Probably if we are having more collated data from several hospitals, we'll be really able to have sufficient sample size to differentiate both Covaxin and Covishield, considering the fact that Covaxin is so a small population really gets Covaxin. Only 50, even in your study, I think it was only 15 people in that group had received Covaxin. So definitely it's a point well considered. Maybe in future we'll be seeing more studies of that kind. So just so that we once again want to apologize for the late start, but I think it was something worth waiting. Thank you so much, Subro, and congratulations once again to your team. And
Thank you, Melvin,
thank
for
you,
making this
Natesh.
so. Thank you, Natesh. And again, apologies from my side. This has been quite a challenging experience, but finally, I would say thank you to one and all. Thank you, Natesh.
Over to you, Natesh.
Thank you, sir. Thank you, Dr. Melvin. Thank you, Dr. Subro. Thank you, all the participants. And yeah, the recording will be available on YouTube. And my personal closing note, I think we should need a complete registry of all the hospital study. Like Dr. Melvin, like he's involved in a cardiac registry. So if you're going to pull this kind of data post-COVID, vaccine, either a Covaxin or Covishield, if you're going to pull the data, and we can have some real-world evidence, which can be really worthwhile to speak on. So thank you. So we'll again meet you with a different program. Thanks everyone. Good night.
Thank you. Good night. Bye-bye.
Thank you all. Bye.